Nearly 1 out of every 100 babies is born with a heart defect in the U.S. And many heart defects don't need treatment or can be fixed, but some, like congenital heart disease, can cause serious health problems or even death. And next week is Congenital Heart Disease Week, and here to discuss this condition is Dr. Carlos Mary. He's a congenital heart surgeon from UT Health Austin. You were just telling me you're new to the Austin area.
That's
from
correct.
Dallas. Welcome, and thank you so much for being here with us today to talk about this important topic.
Thank you.
Yeah, can we just start out by talking about what exactly congenital heart disease is and how rare it is?
Well, congenital heart disease is basically when someone's born with malformations or defects of the heart or great vessels. And it's actually not that rare. So as you said, approximately 1 in 100 children that are born in the United States will have congenital heart disease.
That's a lot.
Now, about 1/4 of them will have severe congenital heart disease requiring some type of intervention during the first year of life.
Okay. Well, how do you diagnose it, and then what kind of treatment options are available once you do?
Well, currently in the United States, most of the diagnosis actually happens in pregnancy, a lot of the times, especially for critical disease with fetal ultrasounds, etc. Now, sometimes patients are born and do not have a diagnosis of congenital heart disease, and they present because of low oxygen levels or difficulty breathing. Sometimes a murmur is heard by a pediatrician. So there's different ways of diagnosing that throughout life. In terms of treatment, it really depends on what kind of disease and how severe it is. Sometimes it's just observation. A lot of the times you require some intervention with catheters or even open heart surgery.
Are children the only ones who can be diagnosed, or is it found later in life sometimes?
No, it can be found later in life. Most of the patients with congenital heart disease will be children at the time of diagnosis, but sometimes, especially those that do not have severe malformations, can actually go into adulthood before getting diagnosed. Now, interestingly, because we've gotten so much better at diagnosing and treating these diseases, patients that before used to not survive, now they are surviving. So
Awesome.
Currently in the United States, there are more adults living with congenital heart disease than children.
That's good news for families that face this diagnosis.
Yeah.
I know it has to be such a stressful time when they get this diagnosis for their child. Tell us about some of the support that parents can get at the Texas Center for Pediatric and Congenital Heart Disease at Dell Children's.
Yeah, so it is pretty stressful, and that's something that we're actually focusing our efforts a lot as part of our program. So in addition to the general support that they get from pediatric cardiologists, congenital heart surgeons, and all the other clinicians, we actually are building a pretty robust team of psychologists, child life specialists, social workers that really basically support the patients and their families during these hard times. So patients, as they come into the program, they get some psychosocial assessments, etc. And then when we identify needs, they can actually get therapy or any further support.
That's wonderful. Not only treating them, but really partnering with them to help them through the whole process. Well, Doctor, thank you so much for being here
You're
today.
welcome.
We really
Pleasure.
appreciate it.
Thank you.
Well, here at KXAN, we're committed to helping you learn about your health along with our partner, the American Heart Association. For resources and easy tips to live healthy